We now move on to our next debate, and I would like to call Claire Perry.
I'm most grateful to you, Mr. Streeter, for chairing this debate today, and I suspect that I believe you're also devoid of minor injuries units in your constituency, so you may be paying attention to some of the discussions. I'm also very grateful to my colleagues, in particular the Honourable Member for North Swindon, for taking time out of their hectic schedules. And may I also say how grateful I am to the Honourable Member for Hexham, who many will know worked so selflessly on the judicial review that resulted from the shutdown in services in Savernake Hospital. If I had £1 for every time during my selection campaign that I was told if Guy Opperman was standing you wouldn't stand a chance, I'd be a very rich woman today. But thankfully we have both made it to this place and can campaign together on this and other important topics. I'm also most especially grateful for the Minister for attending today, as I know that the launch of his team's momentous proposals yesterday means he must have an extremely long to-do list at the moment. And I would also like to mention briefly my local paper, the Gazette and Herald, who have been tireless campaigners on this matter of loss of our local health services, and the hundreds of other individuals in the constituency who have protested, petitioned, written, held meetings and tried to the best of their ability to roll back this tide of closure and service erosion. I wanted to mention just briefly the -2 group that was set up to support the Devizes Hospital, the new Devizes Health Matters Forum set up only this month to try and resolve the impasse we've reached in Devizes, and the Cash Group, who fought so long and hard to keep both the day hospital and the minor injuries units at Savernake in Marlborough, a hospital that was completely rebuilt in 2005 under a PFI contract that will cost taxpayers almost £70 million over 25 years, but which saw the services at its core, the minor injuries and the day hospital, closed down less than a year after its reopening, and which now hosts a multitude of services completely unrelated to local healthcare, such as the Eating Disorders Clinic for patients of the Oxfordshire and Buckingham Mental Health Partnership, as the Wiltshire PCT scrambles to pay its unitary charges. In my constituency of Devizes, the 25th largest seat by land area in England and home to over 91,000 people, the last 13 years of NHS management, I would submit, has meant multiple top-down initiatives, continuing reshuffling of priorities, and the management of local health services by quangos. The result has been clear: a slow and steady erosion of our local health services over the protests of clinicians, patients, and politicians. Let me just refresh memories as to what we have lost. In the Devizes Hospital, the UNICEF award-winning maternity unit, the inpatients facilities, the minor injuries services, and now the X-ray department, all gone. In Marlborough, the day hospital, maternity unit, the minor injuries facilities, and now 50% of the inpatient beds, also all gone. And this pattern has been replicated across the rest of Wiltshire as services are farmed out to neighbourhood or community teams, which can deliver good outcomes in some, but not all cases, or services are concentrated in larger hospitals in the bigger cities of Swindon, Bath and Salisbury. It was in January 2007 that the Wiltshire PCT set out its vision for services in the now infamous Reforming Community Services in Wiltshire document. This announced the closure of minor injuries units in Devizes in Marlborough and the axing of a host of other services, driven in large part by the burgeoning financial deficit the PCT had inherited when it merged from 3 other organisations. And it was, in my view, this loss of reliable local minor injury services that, of all the changes, was most keenly felt. My constituents literally have nowhere to go locally if they suffer a fall, a cut, a wound, or some type of minor trauma. Nurse practitioner-led minor injuries units had for years served the constituency well, were well used, cost-effective relative to sending patients to far more high-spec A&E departments, and were extremely popular. And indeed, I can find no one, literally not one person, with the exception of the head of the PCT, who thought that the decision to close these minor injury services and ask people to travel to Trowbridge or Chippenham, the Great Western Hospital, or a walk-in centre in Swindon, the Royal United Hospital in Bath, or Salisbury District Hospital, was a good decision. Just consider for a second that my constituency ranks amongst the 20th lowest for population density in England, with only 20 people per hectare. And any who have visited, and I hope many of you will know that there are almost no dual carriageways, no railways that connect our major towns, and very few direct bus services. As a result, journey times are extended, and for families or individuals without full-time access to private transport, up to 25% of people in the town of Devizes, it would be a pleasure to give way.
Thank you very much.
Tomlinson.
Thank you for allowing me to intervene on this very crucial debate that you secured for Wiltshire residents. And it was on this specific point of public transport that I wanted to highlight something which I think supports your case, that when the Great Western Hospital in Swindon was set up in the area that I represent, green travel was the emphasis. And therefore there was a limit on the amount of parking provision that was provided, and your Devizes residents that are sent to Swindon almost invariably come by car, and there just simply isn't adequate parking provision available.
Perry.
Thank you. I thank your Honourable Member for Swindon for pointing out something that is extremely important. We have built hospitals with very sound principles of encouraging local travel, encouraging walk-ins. But when we had this major service review, we forgot that most bus services, in fact, don't go from the places where minor injuries were provided to the existing services. In fact, it is impossible to take a bus from Marlborough to any of the 6 suggested places to attend for minor injuries services. I was quite interested in what the current PCT guidance was. So last night I phoned NHS Direct and said, what would you tell me to do if I had a bad cut and lived in Pewsey, which many will know is right in the centre of my constituency and is home to around 4,000 people, one of the largest villages in the area. The guidance I was given was to go to Swindon Hospital Accident and Emergency Unit, a journey of only 16 miles. But as we know now, the crow flies is not a good definition of distance in rural constituencies. In fact, if you can do a simple Google Map search, and you will find that that journey takes you between 38 and 46 minutes by private car. I submit that is too far to travel if you are a mother of a child with a bleeding head wound or the care of an older person with a trauma or a fracture that needs immediate attention. Or consider that the journey that the residents of Honey Street, a lovely village right in the heart of the constituency, would be advised to get to their nearest services, again by private car, 37 minutes to Chippenham, 40 minutes to Trowbridge Hospital. In fact, there is only one other constituency with a lower population density and no minor injuries provision, and that is South West Norfolk. And most of the other spread out rural constituencies are blessed with more than one. In fact, they trumpet their facilities as being appropriate for populations in a rural area. North Devon has 4 units. These are all constituencies with similar or slightly lower population densities. Rutland and Melton, 3 units, and the nearby Cotswold constituency, also 3 units. So how we might all be asking, could this situation have arisen? I submit that it's because decisions about our local healthcare have been taken by decision makers who were unelected, unaccountable, and often uninterested in the local consequences of their actions. Not because they're bad or malicious or unintelligent people. In fact, I know there are many very good and very dedicated healthcare professionals in the PCT. But the whole system has rewarded top-down compliance with central government diktat and ignored the needs and wishes of the population. And indeed, only last week, the head of the Wiltshire PCT, when I went to see him about the proposals in the white paper that we had heard about, said that he had no intention of reopening the minor injuries units we have lost and that there was no case to do so. So if I might turn to, is there actually a case to be made for this services? And this is something I would very much like to ask the Minister for his opinion on, but if I could do so before that, I'd like to present just 4 facts to frame the rest of the debate. The population in my constituency, as is the case across much of rural Britain, continues to grow. We are seeing a population flow out of the cities into the villages and hamlets of the UK. Population in my area is up 5% since the turn of the decade, and indeed part of the support for the redevelopment of Savernake Hospital was the almost 20% predicted growth in population in the Swindon and South environs that hospital was actually supposed to support. I also believe that the Alberti report, the emergency access report published by the NHS in 2006, suggested that it was both better clinically and more cost effective to send patients out of A&E departments and into local urgent care centres where we could use more nurses, paramedics and nurse-led emergency care practitioners to treat patients. The PCT's own data, and I must say I'm most grateful for them for providing this, shows that in the last year there were 17,086 attendances of patients registered in my constituency at the minor injuries units in Trowbridge and Chippenham and the A&E departments in Salisbury and Bath. And as I've already stated, the journeys people are having to take to access these facilities, in my view, are unacceptable. And the cost of providing those services at the current tariff is £1,352. It seems to me, with our new localism agenda, that given the current costs that the PCT is paying for minor injury services for my constituents, that a business case could surely be made for restarting a minor injury service within the constituency, as long as the total cost was below the current tariff being paid. I know that there are doctors in both Devizes and Marlborough who have expressed an interest in restarting the service and have it being delivered by nurse practitioners who are located within their practices. And there are certainly premises, including the half-empty and shuttered Savernake Hospital, in which to locate the service. And what I would therefore like to ask for the ministerial guidance on is, can he tell us, in the light of our NHS reforms, how we move this process forward? And as we know, the current PCT, which I believe will be in existence for at least another 2.5 years, has no interest in recommissioning the service. Can we go around the PCT in this interim period? Can we approach the Sustainable Communities Act legislation, for example, as a way to get back these services that I believe we so desperately need? And if, yes, I'd be delighted to give way.
Thank you, Mr. Streeter. I commend the Honourable Lady in securing this debate. On that very point, we recall some years ago when these closures first happened that we petitioned the Health Overview and Scrutiny Committee at Wiltshire Council to intervene on our behalf. And I'd be very grateful for an indication from the Minister as to whether he felt that they had a role to play in standing up for the concerns of the residents, constituents, patients that have written to the Honourable Lady, and indeed myself, where we have lost the minor injury unit in Melksham in my constituency, which is far closer than the one in Chippenham to her own constituents.
And I thank the Honourable Gentleman, Member for Chippenham, for making an excellent point. Indeed, it is very interesting to me because a subtopic of this whole debate has been the failure of the PCT to deliver a new primary care centre in Devizes, which was promised as part of the quid pro quo as when these closure announcements were made. And when I suggested last week that perhaps the time had come to rip up the original plans that seemed to be stymieing progress and go back to the drawing board and say, just how can we deliver a hospital in Devizes under our current constraints, I was indeed referred back to the Overview and Scrutiny Committee at Wiltshire Council that clearly has a very important role to play in defining the services we need for our local community. So can the Minister tell us, rather than waiting till 2013, can we submit pilot proposals to this national commissioning body? When will it actually be up and running? Or can we start to make progress, by example, looking for voluntary sector partners right now to begin a pilot programme? We would be most grateful for his thoughts. I'd like to conclude by saying that there are a few things that unite all of the people in my constituency, but the sense that we have been shortchanged by our PCT and indeed the NHS over the last 13 years is, I think, almost universal. I am sure we are all united in welcoming the exciting proposals that the Minister and his team announced yesterday, and I know that the ideas of equality, excellence and liberating the NHS and the possibility of getting back some of our minor injury services certainly makes my pulse beat a little faster. Thank you.
Minister Simon Burns to respond.
Well, Mr. Streeter, can I begin by congratulating my honourable friend, the member for Devizes, on securing this important debate. I know that the local health services are a top priority for her and that she has campaigned vigorously before she came into this House, and as we've seen today, since she has entered this House, on behalf of her constituents, to ensure that she gets the best healthcare provision for those people that she so ably represents. And I admire her dedication and her determination in fighting that battle for her constituents. I'd also like to pay tribute to the NHS staff, both in Devizes and across the whole of Wiltshire, for the excellent care and dedication that they provide day in, day out, looking after my honourable friends' constituents and those of honourable members within the county. As my honourable friend is aware from the comments that she has made, my right honourable friend launched our white paper for liberating the National Health Service, which is our vision of how to free the health service from the shackles of politicians and bureaucrats here in Whitehall, and giving power to the people at a local level, working with clinicians and general practitioners to provide those services that each local community throughout Devizes, Wiltshire and the country need. It is a vision where we want to make the NHS more accountable to patients, whether they be my honourable friend's constituents in Devizes or elsewhere in the country, where we free staff from the excessive bureaucracy and top-down control, where patients will be at the very heart of everything that the NHS does, and that local people will have more choice and control than they have ever had in the past, and a greater say in their treatments, their needs and their health requirements. People in Devizes and the other small towns and villages mentioned in my honourable friend's speech will be in charge of making decisions about their care and their provision of health requirements. My honourable friend has outlined the strength of feeling in her constituency for the local minor injuries services and the support that there is in that area for the NHS in general. I understand, looking at the current situation, that the minor injuries units in Devizes and Marlborough at Savernake Community Hospital closed in September 2007, and I know that my honourable friends and her constituents were understandably disappointed at that decision and have been frustrated by the difficulties and delays that have resulted from that decision being taken. I'm aware that people living in different parts of her constituency access different minor injuries units, including the community hospitals, as she said, at Trowbridge, Chippenham, Andover and Newbury, and that minor injury treatment continues to be available at the A&E departments in the acute hospitals in Salisbury, Bath and Swindon. And as my honourable friend rightly said, this can, for certain members of her constituency, cause problems because of the transport access. And for that I have considerable sympathy with the points that she makes. I'm also aware that my honourable friend's constituency covers a large rural area, and she gave some extremely interesting figures and comparisons with other rural constituencies throughout England to make the point that she so powerfully made. And for that reason, I can also equally understand her desire for local minor injury units that are accessible as quickly as possible to her constituents. But I am afraid that I have to be frank with her, given where we are at the moment, given the processes that have already taken place within her county and her constituency on reconfiguration of services, that I am not able to ask the NHS to open previously conceded processes, nor halt those that we believe have passed the point of no return. I know that that will come as a disappointment to my honourable friend, but I am afraid that at the moment we are where we are because of the decisions that have been previously taken and the degree to which they are in the processes. But my honourable friend also asked what could be done. She suggested could pilot schemes be produced as a forerunner to the abolition of the PCTs in 2013. She also suggested other ways of working with other outside interests. And to give her as clear a steer as possible, I have to tell her that unfortunately, until the PCTs are actually closed and cease to exist in 2013, there are due processes and proper procedures that have to be adopted for her to move the way forward. And at the moment, the PCTs will continue until they are phased out from 2013 to have the same responsibilities that they have now with regard to the provision and commissioning of healthcare in each area that they are responsible throughout the country, including in Wiltshire.
I thank the Minister for giving way, and I pay tribute to Claire Perry for carrying on the work that all of us have been doing for some considerable period of time in relation to the hospitals in Wiltshire. and I, for one, spent 3 years of my life trying to keep them open. The comments that the Minister are giving, though, is that in reality, whatever the situation, despite the fact that Andrew Lansley said in 2007 that clinical need should justify whether something should close, despite the fact that this is fundamentally an accounting measure, despite the fact that we are in a situation where decisions apparently are not to be reviewed in any way before 2013, you have people desperate for a hospital to reopen, which is pre-existing, prepaid, and already in a position that it is sitting there.
Order. Can I remind the honourable gentleman that intervention should be brief?
It's a long question. Mr. Streeter, I apologise, but the point being, it is still there and is well capable of being used. And with the greatest respect, I fail to see why it is not being used.
Minister.
Well, I'm very grateful to my honourable friend's intervention, and I can fully appreciate his frustration at the situation, though I also appreciate that it's my honourable friend's greater frustration, because of course it is her constituency that is directly affected with the issue that we are discussing today. But I have to repeat that I'm afraid we are where we are. We do have a vision for the health service. We have a vision where we believe it should be from the bottom up rather than the top down. But until the changes occur, we are in a straitjacket of the procedures that are in place at the moment that have to be adopted. And I was going to say to my honourable friend, as a way of offering some glimmer of hope before the intervention by my honourable friend, that she asked what is the way forward. And I will give her advice as I see the way forward, both as a constituency MP and as a minister. And that is that as long as we are in the position that we are in during what is now in effect an interim period since the publication of the white paper yesterday, where we do still have the PCTs commissioning services where they are the lead role, what I would advise my honourable friend to do is to continue her spirited and dedicated campaign to get what she is seeking for her constituents, to continue seeking to persuade the PCT, local clinicians, GPs, and the local community to stay on side in the desire of trying to establish that a minor injuries unit and the other care that she talks about is instigated for her constituents. And at the moment, the only way forward is through that route, because it is the PCTs that are the commissioning agents. And I would urge her strongly to continue her campaign in the hope that she can, in the next 3 years during this interim period, try and get a change of heart if that is possible, or if not, when the changes come in, to then use the new system to seek to impress those who will be in charge of reconfigurations and the provision of services, to reinstate services that she so passionately and rightly believes are what her constituents need and deserve. That is my advice to her. It may not be as palatable as she would hope, but I know she will appreciate and understand that in the current circumstances, we haven't yet changed the system. It is a vision that was announced yesterday. It is a vision that will be for the future, that will hopefully...
Claire Perry, certainly are.
Thank you very much for allowing me to intervene. So may I take from that by 2013, if we get our ducks in a row and we get our clinicians on side and we get our draft contracts drawn up, that we will be able to present that business plan in whatever forum we are in to the national commissioning body and have some chance of success. May I take from that there is hope that within a 3-year period before the next election, we may well get these services back under a new contract commissioned by the central body?
Well,
answer specifically.
I cannot give a commitment, obviously, that my honourable friend would be successful. I wish her well in her endeavours, but it is not for me to prejudge what might happen. But where my honourable friend is right is certainly putting, as she calls it, her ducks in place with a business plan for what she believes her constituents should have, to the National Commissioning Board, but also to the GP consortia in her area, so that she has everyone working together, making what she will believe is an overwhelming case for what she wants to be delivered for the local people of Devizes, for her constituency. Because if I could just make some progress, please. Because, as my honourable friend will accept, the times they are a-changing. The government's approach is different to the last top-down approach of the previous government. We do believe that local decision-making is essential to improve outcomes for patients and to drive up quality. We will do more than just talk about pushing power to the local level. We are actually, as my right honourable friend's white paper shows, going to actually do it and make a dream a reality, which will be of considerable help to my honourable friend in her campaign. We must move away, as my honourable friend would certainly agree, given the experiences that she has had during her ongoing battle. We must move away from dictating from Whitehall how care should be delivered in Devizes or in Westbury or any other town or village in Wiltshire. We believe that the change has got to be driven from the bottom up, where the patient is at the heart of the provision of healthcare, where it's the patient who is put first. It is their interests, their quality healthcare that is the number one priority, not the decisions and the ramifications and the shenanigans from politicians and civil servants. So in future, all service changes must be led by clinicians and patients, not driven by ministers like me or civil servants in the Department of Health. Only then will the NHS achieve the quality improvements that we all want to see. And I'll give way to the honourable gentleman.
Duncan Hames.
Thank you, Mr. Streeter. I'm grateful to the honourable gentleman for giving way. Clearly, in his search for some local accountability for decision-making, it would be very helpful if he could advise us where in this process that the public's demand for these services will be heard, and indeed whether there is a role for locally elected politicians through the health overview and scrutiny committees of our local councils to secure some real influence in determining these outcomes.
Well, if the honourable gentleman is talking about now under the current arrangements, then no doubt he is aware of the changed criteria that my right honourable friend, the Secretary of State, announced in late May for any that had to be taken into account for any reconfigurations that are currently going through the process, providing they're not too far advanced that it's impossible to reverse them, and any future reconfigurations, where the main four priorities are taking into account the views of local people, clinicians and GPs, and making sure that it is relevant healthcare for the local area. If he is talking about after the changes in the white paper have been implemented, then of course, as he will know, as the PCTs are wound down and abolished, the transfer of powers not only to the National Commissioning Board and all that flows downwards from that, but then linking the provision and the responsibilities for the delivery or the commissioning and delivery of healthcare at a local area will be linked to local authorities, where there will be accountability through the local authority input, where of course there are locally elected representatives on those bodies, in a way that currently public health is dealt with through the input from the primary local authority level in each area. And that is where the accountability will be. But the predominant thing is, because one has to have a health service that is locally driven, is that the wishes of the patient, not only in their own individual care, but the requirements that they have in the local community for what they need as a local community, has got to be fundamental in the decision as to what units, what configurations take place. And I hope that the honourable gentleman and my honourable friend is reassured by that. In conclusion, Mr. Streeter, can I once again pay tribute to my honourable friend for the way in which she has fought so hard for her constituents, not only, as I said earlier, before the election, but she has shown that it wasn't simply before the election she gave this commitment and this dedication to fight for her constituents. She has now been in this House for 8 weeks or so, and yet she has made her mark already, fighting for her constituents, fighting on this issue which she promised her constituents during those long days in April that she would take the fight to Westminster. She's here in Westminster, she's taken the fight here through this debate today, and I have every confidence that not only will she continue to use the means available to her in this House to pursue her agenda, but she will also mobilise support in her own constituency to make sure that this isn't an issue that is going to go away. She is going to be determined to get what she believes is the best healthcare for her community, and in that respect, I wish her every success.
Order, order. The sitting now stands adjourned.